Hi friends, I am Dr.Swapna Chekuri from Hyderabad Women and Fertility Centre. Welcome to my channel. So today let us discuss about what are the possible causes of failed IVF and how to go ahead with the failed IVF cases. So basically, first of all, when a couple comes with failed IVF, we usually evaluate three things. One is what was the quality of the embryo, was there any difficulty at the time of embryo transfer, and what was the how was your endometrium at the time of embryo transfer. So coming to the embryo, basically we need to evaluate what was the grade and stage of embryo. So basically either it could be a day 2 or day 3 embryo, or was it a day 5 blast embryo, that we need to evaluate. And what was the grade of the embryo, is it AA grade or AB or BB grade. So depending on the grade of the embryo also we can just assess what could be the reason for failed IVF. And most important is, like, if the lady is elderly lady and the husband factor is also there, elderly male, obviously the quality of the oocyte and quality of the sperm will be definitely compromised. In those cases also, in spite of after ruling out all other causes, then we can advise for either a donor egg or a donor sperm. Obviously we give the options to the couple, they have to decide, and they have to take a decision. So that is coming to the embryo. Then next thing is like embryo transfer technique. So first of all, when a couple comes with failed IVF, we usually ask for the discharge summary. In that it will be written, was the embryo transfer technique smooth, uneven, full, or was there any difficulty at the time of embryo transfer. Sometimes there might be a difficulty in negotiating the catheter as well. So in those cases we usually advise for hysteroscopy. So in hysteroscopy we evaluate right from cervix, was the cervix okay, or is it stenosed, and then once when we enter the endometrial cavity, is the endometrium healthy, and is there any polyp or small fibroid or cynic adhesions, then we need to clear out all those things. And most important is endometrium, because see, in IVF embryo will be formed outside. We can know the quality of the embryo or the grade of the embryo and stage of the embryo, and in spite of selecting a good embryo, if the endometrium is not good, then also the chance of IVF failure might be there. Okay. So in endometrium we usually evaluate what was the vascularity, how is the vascularity of the endometrium, is there any scars over the endometrium, like in case of old healed tuberculosis or in case of pelvic infections, we usually find problem in the endometrium as well. And even a patient suffering from endometriosis or a small submucosal fibroid, even those cases also there are chance of failure are more. So all these things we need to evaluate before going ahead for the second IVF transfer. And then coming to this thing now, like endometrial receptivity assay. So in cases of repeated IVF failures, we usually advise for this test ERA. So in this ERA, we usually prepare endometrium same as of like a FET cycle. Once the endometrium is ready, we take a piece of endometrium and we send for the genetic testing just to rule out any infections. And then that ERA test also gives us the implantation window, whether the time was correct or not to transfer the embryo. So it just tells us about the implantation window, whether the timing is correct or not. That's it. Otherwise even if we do ERA, we cannot 100% guarantee that next IVF will be a 100% successful pregnancy. And then coming to the next point, embryo, like even in embryo we usually advise for PGTA, that is pre-implantation genetic testing for aneuploidy. Basically we need to rule out whether the embryo was euploid or not. If at all any aneuploid embryos are there, we usually discard them. So in cases of repeated IVF failures also, in case of elderly ladies or a previous bad obstetric history, we usually advise for PGTA. So these are all the precautions which we can take to prevent the negativities in IVF pregnancies. So friends, if you find it informative, please like my video and share with your friends and needy people. Thank you.